A number of things to talk about in our Facts Not Fear coverage of COVID-19. 3 things you need to know about the fight. A COVID-19 booster shot could be on the way for kids ages 5 through 11. Pfizer applied for emergency use authorization. Meantime, the FDA approved the antiviral drug remdesivir to treat COVID in patients as young as 28 days old. And the U.S. has now purchased 20 million treatment courses of the antiviral drug Paxlovid. This morning, we're going to be answering some of the questions you have about these new tools to help in the fight against COVID-19. Dr. Leila Javidi from Central Ohio Primary Care is joining us this morning, and we are grateful for that. Thank you so much, Dr. Javidi.
Good morning.
Good morning. Pfizer just asked for that emergency use authorization for the booster for kids 5 to 11. Can you talk a little bit about the guidance that parents should expect this summer as they're doing all of those well checks for back to school?
Yeah, I think that what's really important is for us to go back to about September and remember what it was like when we were first being recommended to either get vaccinated for the first time or boosted as adults. And everyone's like, I don't think I need that. And then we saw the most incredible spike that we've ever seen in Columbus, Ohio. I think we have to acknowledge that this is going to be around. And if we are recommending boosting, whether it's for you or your child, it's because we have the evidence that your immunity has waned, and it would behoove you to get a boosted immunity so that we can prevent serious disease from COVID. And so that's what I would say about, guidance going into the summer.
All right. So that antiviral Paxlovid that's being pushed by the White House to really help in this fight. How can using Paxlovid help as these cases start to creep up again?
Well, the great news about having this antiviral is that there's still a significant amount of people who have decided for whatever reason to not get vaccinated. And although we continue to recommend that, we still would like to keep those individuals out of the hospital. So if given within a few days of starting your symptoms, it can reduce your hospitalization rate by almost 90%. So it's basically almost as effective as a vaccine if used properly. Mm-hmm. But what this is going to be really important in doing is you need to have tests on hand, and you need to identify ahead of time where are these places that would either offer a test to treat program where you get tested and then they hand you the treatment, or make sure that your primary care office is able to do this as well.
And then, Dr. Javidi, what about parents who are watching and their kids aren't eligible for this right now?
It can be very scary. I think we're all still worried about it. But I think if anything, we can look at the past 2 years and see that on the whole, the measures that we have taken have mostly prevented children from suffering significant illness. I think that if you have a child who has special health considerations, you have to continue doing these protective measures, masking, social distancing, once you see those cases on the rise again. But I think while we're, kind of in this other area, we're going to have illness just like we always do. Mm-hmm. But just try to be focused on what you can do to prevent the spread of disease, like on a normal daily basis, washing your hands, covering your cough, stuff like that. And most importantly, getting tested if you have symptoms.
All right. And follow the doctor's advice. Thank you so much for joining us this morning, Dr. Javidi.
Yeah, thank you so much.
All right, the CDC says nearly 60% of Americans now have antibodies against COVID-19. The study shows it's because of the Omicron surge this winter. Unfortunately, experts say they still don't know how long infection-induced immunity lasts, which is why it's important to get vaccinated and boosted.